A San Diego father is taking a stand for patients' rights after losing his own son to cancer.
He tells 10 News reporter Amanda Brandeis it was cannabis that gave his son quality of life in his final weeks.
He was a wonderful person.
At age 41, Ryan Bartell had already achieved so much. A two-time All-State runner, served in the Coast Guard, and was helping autistic children alongside his wife.
Ryan called me on March 1st of last year to say that he had been diagnosed with stage 4 pancreatic cancer.
Jim Bartell has been sharing his son's story. After the diagnosis, doctors immediately tried chemotherapy, but it didn't work.
They had him on morphine and fentanyl, two very serious opioids.
They caused Ryan to mostly sleep for 4 weeks, until he asked his dad for cannabis.
We went from being asleep most of the time on fentanyl and morphine to being alert and being able to communicate, text, talk to friends.
But most patients never get this option.
While medical cannabis has been proven to help with reducing nausea, vomiting, and pain, hospitals in our state are expressly prohibited from providing it to patients.
Because of the Federal Drug-Free Workforce Act, hospitals have adopted policies prohibiting cannabis in their facilities. State Senator Ben Hueso wants to change that with Ryan's law. Healthcare facilities which treat terminally ill patients would be required to allow the use of medical cannabis, meaning patients could bring their own product inside the hospital. New York already has a similar law.
He'd be very proud. I think he is the kind of person who would want other people not to suffer.
Amanda Brandeis, 10 News.
Now, the legislation would require terminally ill patients to have a medical marijuana card or a physician recommendation. They would not be allowed to smoke or vape the marijuana. It would have to be edible, oil, pill, or spray form.